A team from the United States Southern Command Lesser Antilles Medical Assistance Team has been operating surgeries side by side with Guyanese doctors over the last 2 days since arriving here. Over the next few weeks, the teams will continue to collaborate for a dental and surgical outreach at the Georgetown Public Hospital Corporation and the West Demerara Regional Hospital, with the goal of covering several cases. Lieutenant Colonel Gentry Mobley, who is in charge of the mission, told reporters on Wednesday that in order to respond to the needs of the patients, supplies worth US $230,000 were shipped to Guyana.
Our mission is going to be here for about, we're on a 2-month medical mission across the Caribbean, but we're going to be here for about 16 days. So we're excited for those 16 days of strengthening partnerships, increasing our interoperability. We're not just doing these surgeries on our own, we're doing side by side with your surgeons. And expressing and exchanging that knowledge so that we don't just cut on a few people and then leave, but that knowledge gets transferred and stays with the surgeons going forward. And that's the surgeons, that's the anesthesiologists, that's the nurses, that's the techs, that's the logisticians, that's the dental. Everybody's working side by side all through this mission to make things happen.
Already, 14 surgeries have been conducted at the Georgetown Hospital, while close to 60 patients have been treated in the dental outreach at the hospital on the west coast of Demerara. The mission is supported by the Air Force's Southern out of the United States. The Lieutenant Colonel also said that this collaboration is allowing both the U.S. surgeons and the Guyanese to exchange knowledge. It is a partnership that was welcomed by both teams.
I want to assure all of you that your presence in Guyana is one that is valued and cherished. I want to assure all of you that in our vision and in our planning, the U.S. teams that have worked with us, and in particular the U.S. military team that have worked with us, will see enhanced partnership rather than reduced partnership.
That was Dr. Leslie Ramsamy, an advisor to the Health Ministry, who said Guyana relies heavily on the U.S. for healthcare. Meanwhile, U.S. Ambassador to Guyana, Sarah Ann Lynch, reiterated the importance of such partnerships.
We are very excited to welcome this U.S. Southcom team to Guyana as it conducts routine medical engagements throughout South America. I think you just came from Suriname and the Caribbean to build partnerships, provide relief to overwhelmed medical facilities, and improve our collective ability to meet complex global challenges. This mission is representative of the United States' commitment to the people of Guyana as the country continues its astounding trajectory toward increased prosperity and development. LAMAT honors our promise to be a trusted partner in Guyana by increasing collaboration so that we can quickly work together when support is needed. The U.S. and Guyana have much in common, and the strong relationship between our countries is based on mutual respect and shared values.
Director of Medical and Professional Services, Dr. Navindranath Rambaran, and the Chief Executive Officer of the Gphc, Robbie Rambaran, were also in attendance at the event. Lazeena Yearwood reporting for the newsroom.